I take a look at the business community. I take a look at how well the bosses are doing. The top 100 CEOs in Canada, if you can imagine, made on average $7.9 million last year, and about almost $600,000 goes into a pension plan over and above that. Corporate community is sitting on so much dead money today that if the corporate community started to reinvest, there wouldn't be any debt at all in Canada. So here we are at a time when we're creating more wealth than we ever have in the history of our country. They're saying that the healthcare system is under crisis. So here I've spent the last 2 days going through long-term care facilities, hospitals, and you see the cutbacks everywhere. You see how you're understaffed. You see how once again we're being told as workers that haven't had a pay increase since 2011 that once again we have to accept nothing. And that's just not going to happen here, brothers and sisters. Woo! Woo! Facts are, they're talking about, and they continue to take cutbacks in the system. And we watch as I take a look right here. I take a look at the hospital behind us where there's 290 beds, yet they're only using 220. Why? Because of reduction in funding. And I sat yesterday in Thunder Bay, and I met our members in Thunder Bay. So here they did a major fundraiser for the hospice unit within the hospital at St. Joe's. And after they did the fundraising, they reduced it from 20 beds to 10 beds. And then right now they have in an application before LHINs to reduce the palliative care beds by a half. So what does that do? What it does is it forces our parents, our grandparents, those who are the most ill, to have to leave their community where they live their whole lives, where their families still live, leave their community to spend their last remaining moments. That doesn't make a damn bit of sense to me at all. So here we're at a point in our history where we need to be looking to invest more, not less. So here the federal government, if you could imagine, Harper is refusing to renegotiate the healthcare accord and is taking $36 billion out of the healthcare system.
Ooh, so shame!
Here the Canadian population has gone from 30 million to 34 million. The population is aging. So instead of being the caring, passionate country that we are and understanding our responsibility to those that built the country, we're spending all our time talking about how we're going to take less. That's just not going to happen. And here's what else drives me crazy. We haven't had a pay increase since 2011. And we're being told once again, sorry, the healthcare system is under pressure. We don't have any money, but we seem to have money for everything else. And what really annoys me is what the management teams do. Because they retake zeros. What do? They restructure their jobs. Instead of being called this, we're going to call ourselves now this, and we're going to get a pay increase. Sure. And then on top of that, we're going to give ourselves a performance bonus.
Boo.
And then on top of that, we're going to give ourselves 2% to 2% and 2% increases. All the while, we're supposed to accept nothing. Well, it's not going to happen in 2014, or this is going to be one hell of a fight to make sure that we get justice. So you need to know, we're spending a lot of time talking to the Wynne government. And we're saying to the Wynne government, you've got a majority because healthcare workers across the province supported you. They understood that supporting him, Tim Hudak, would have been a disaster. And we all know that. Think about it. Can you imagine a person running on the platform that they're going to eliminate 100,000 public sector jobs? Teachers, nurses, healthcare providers, just absolutely insane. So people supported her vision, but her vision has to include that the working class people are going to continue to have wage increases that at least not only just keep up with inflation, but frankly do a little better than that. So there's a lot of issues before us today. There's lots of issues, and I want to say to the management here at the Sault Area Hospital, like I said to the management team at the Thunder Bay Hospital yesterday, you know what, if wage increases are good enough for them, well, it's bloody well good enough for us as well. So this debate is going to be the defining moment in the next federal election. There's no question in my mind. Because we can't have a government that's running on the concept of privatizing healthcare in Canada. You can never survive. And I take a look at some of the issues, and I take a look at some of the relevant issues, and I take a look at the women that are here, because there's no question about it, the healthcare system is predominantly women. And I take a look at some of the issues that are so prevalent today that aren't being addressed. I take a look at the fact that Harper won't call an inquiry on over 1,100 missing and murdered Aboriginal women.
Shame!
Can you imagine if we had over 1,100 missing and murdered white Bay Street lawyers? There'd be an inquiry tomorrow morning. And then I take a look at what they're doing to the veterans, like shutting down all the offices across the country. What did it save, about 8 cents? And then, of course, the attack of the healthcare system. I go on and on and on and on. But this really is about customer care. It really is about us finally having the resources to take care of patients. It's about not treating patients like you're on an assembly line. I take a look and I watch the system carefully. I take a look and I watch the understaffing, and I watch the hours of work that people put in hospitals. And I watch it as they're moving more towards part-time jobs and less full-time jobs, and forcing our members to work in 2 hospitals and in long-term care facilities. That just doesn't make any sense to me at all. So I look at it. My mother's in the long-term care facilities. My mother has dementia. My mother doesn't know who I am. And so I see her, and I take a look, and I look at the pressures in long-term care facilities, which are comparable to the pressures in hospitals. And I see the changes, and I see the changing personnel. And I see that there's not consistency with the same person taking care of my mother day in, day out, because with dementia, that type of consistency is so important. So we're not recognizing the importance of care for our parents and our grandparents and for us. So we need to continue to have these types of demonstrations. You need to continue to debate and argue and educate your neighbors and make sure that your children and make sure that our relatives and our siblings and everybody walks in unison with us, because we can do this. We can win justice at the bargaining table, but we can also lead the debate to make sure that we've got a long-term sustainable healthcare strategy for Canada, where we make sure that we treat our elders and our sick with absolute respect. So on behalf of our organization, on behalf of your organization, thank you so much for everything you do to make us such a better union. We are a better union because and as a result of our healthcare members. So thank you all very much. I'm here. I'm in total support of everything we're trying to accomplish, and I'll make sure I push the Win government to make sure we get all justice. Thank you all.